Okay, we'll be transitioning on now to the fireside chat, addressing age-specific needs and preferences from early childhood through adulthood, early adulthood. And we're honored to have with us today for this fireside chat, Congressman Buddy Carter from Georgia's 1st Congressional District and Senator Chris Van Hollen, who represents the state of Maryland. Congressman Carter is a pharmacist, former mayor, and former member of the Georgia General Assembly. He has served in the U.S. Congress since 2015 and is dedicated to working towards a healthcare system that provides choices, lower costs, and better services. Senator Van Hollen is an attorney who served 12 years in the Maryland General Assembly, first in the House of Delegates and then in the state Senate. He then served in the U.S. Congress from 2002 to 2015 when he was elected to the U.S. Senate. He has been a vocal supporter of the Affordable Care Act. Congressman Carter and Senator Van Hollen have shown great leadership on childhood and young adult cancer issues at the federal level and have a wealth of insight to share with us. Thank you so much to the two of you for being here today and for your commitment to advancing the standard of care for patients with cancer. Our moderator for today's summit is Dr. Clifford Goodman. Dr. Goodman is a senior vice president at the Lewin Group, a premier national healthcare and human services consulting firm based in Falls Church, Virginia. Dr. Goodman has over 30 years of experience working with government, industry, and nonprofit organizations in the US and abroad in areas such as healthcare technology assessment, clinical practice guidelines, and health economics. Dr. Goodman also is a nationally recognized health policy issues moderator and expert panel facilitator, as I know you will see as we go through the afternoon. Thank you for being here with us today, Cliff. Again, welcome Congressman Carter and Senator Van Hollen, and over to you, Cliff.
Well, thanks very much, Dr. Carlson. Glad to be here and pleased to be able to moderate this fireside chat. As you can see, it's about addressing age-specific needs and preferences from early childhood through young adulthood. And you're going to see in a few moments how it is that the Congressman and the Senator are tied into this very, very carefully and closely. I want to just move into it in just a moment. This session will go to 1:10 Eastern Time, 1:10 Eastern Time. At about 12:55 or so, we'll go to audience Q&A, following on our discussion. But if you've got a good question for the Congressman and or the Senator, you know where to apply that question. So I know that Dr. Carlson gave some brief introductions of the Congressman and the Senator, but I want to just start out by asking each of them, starting out with Congressman Carter. What is it, Congressman, that brings you to the specific issue on the work of advancing the standard of pediatric cancer care? What is it about it? We know you're a pharmacist. We know some other interests, but what took you to this issue? And by way of introduction as well, I want to point out that I'm a big fan of Savannah and its environs and a great admirer of that part of the country. Congressman Carter, what brought you to this issue, sir?
Well, first of all, thank you for your kind words. I appreciate it very much. And as you noted, currently I'm the only pharmacist serving in Congress, although that is fixing to change. Next session, we will have another member of Congress who is a pharmacist. One of my colleagues had given me the hashtag OPIC for only pharmacists in Congress. So I guess now that's going to have to mean the oldest pharmacist in Congress. And I'm not real happy about that, but nevertheless. But, you know, as a practicing pharmacist for over 30 years, obviously I've experienced a lot and seen a lot. And certainly some of the worst things that I have seen are, I'm not sure I should say worst things, but some of the things that have impacted me the most have been when it involves children. And I've certainly dealt with many patients, many families who have gone through this, and seeing the toll on them and on the family members, on the caregivers is impactful, and certainly has been one of the things that has driven me to to want to pay particular attention to this subject while serving in Congress. As you know, I serve on the Energy and Commerce Committee, specifically on the Health Subcommittee, and that's very important. And anytime this issue comes up, it always raises my awareness and raises my interest because, as I say, I've witnessed it firsthand as a healthcare provider.
Thank you, Congressman. I think it's implicit as well that as a community pharmacist, you do deal with and have dealt with on a face-to-face basis with patients and families and the day-to-day issues of co-payments and other challenges in the healthcare system. So we appreciate that very much. Over to Senator Van Hollen, and I must admit, I must disclose that I'm a constituent of yours, Senator, as we go on through this. Senator Van Hollen, in addition to the introductory remarks that Dr. Carlson gave, can you tell us a little bit about how it is that you came to this particular issue on advancing the standard of care for pediatric cancer patients? Senator?
Sure. Well, first of all, thank you, Dr. Goodman, for your leadership in this area. And it is great to have you as a Maryland constituent. Good to be here with Congressman Carter and with all of you today. I first got inspired and motivated and passionate about this issue because of moms and dads, first in my congressional district and now in the entire state of Maryland, who had children who either had passed away from childhood cancer and they wanted to make sure that other families didn't experience that tragedy, or moms and dads who currently have kids who are fighting childhood cancer and wanted to get involved to help develop new treatments. And, you know, as I looked into this years ago, it was clear that we'd made significant advances over the years that helped save thousands of children's lives from cancer, but that we also had a long way to go. And back in around 2006, I teamed up with a Congresswoman, Deborah Price. She was a Republican from Ohio. Her daughter, Caroline, had passed away from childhood cancer, neuroblastoma. And we got to work together passing what was called the Conquering Childhood Cancer legislation, which was to create a structure to focus more attention on childhood cancer, to establish more dedicated funding streams and research at NIH, and also to begin to collect more data on the issue of survivors and making sure that we follow these challenges through the life of kids or adolescents who have cancer. So we then launched the Childhood Cancer Caucus in the House. I was co-chair along with Mike McCall, Republican from Texas. And then we worked on a number of other pieces of legislation, some of which we'll talk about today. But I have to say, it was those moms and dads who, you know, came to the House of Representatives, knocked on our doors, told their stories, and inspired me to really get involved.
Well, thanks, Senator. It is often about the stories. And gosh, as we just heard from our keynote, Jan White, those personal stories and struggles have a lot to do with kind of influencing policymakers, decision makers, including such as yourselves. I want to go in order of a couple of acts. And I'll start with the RACE Act and then go to the STAR Act. I think the RACE Act, will start with Senator Van Hollen first. And as I understand it, the RACE Act was passed in 2017, 3 years ago. Its goal was to improve and expand treatment options for pediatric cancer patients. And then following that in 2018, the STAR Act had as its goal advancing childhood cancer research and child-focused cancer treatments, while also improving quality of life for the survivors. And so perhaps in that chronological order, back to you again, Senator Van Hollen, what is it about the RACE Act that is of direct relevance to our program today? And tell us a little bit more about your role in it and how it has been implemented. Senator. Well,
the RACE Act was important, very important legislation. It just took full effect this past August. I introduced it back when I was in the House of Representatives with Congressman McCall, and we worked hard to get it passed then. I've then came to the Senate and teamed up with some of my colleagues here on a bipartisan basis. I must say that this is another example where the idea was really launched by a mom. Her name is Nancy Goodman. She lost her daughter to childhood cancer. She now runs Kids v. Cancer. I don't know if she's part of this call, but she brought this idea to myself and Congressman McCall and obviously senators. And it's based on a simple idea and a very powerful idea, which is we have lots of research being done by lots of companies in the area of cancer and defeating cancer and treating cancer. But in so many cases, those potential therapies and drugs are not available to deal with pediatric cancer, partly because they don't go through that research process and they don't go through the clinical trial process. As devastating as childhood cancer is, of course, the number of children who die of childhood cancer is relatively small compared to adults. And so, a lot of the focus of the drug research has been on adult cancer, and we want to find cures and treatments for adult cancer. But that meant that a lot of potential treatments for pediatric cancer were never brought forward because they didn't go through the testing and clinical trial process. And what this says is now companies developing cancer drugs have to conduct their drug studies in children where the molecular target of their drug is relevant to a childhood cancer. And as we all know, much more of the innovation now in cancer therapies is focused on molecular targeting, not just dealing with sort of organ targeting. And so where a company is developing a drug where the molecular target may also benefit, us addressing childhood cancer, then those companies have to make sure the clinical trials are provided to kids as well, so that they can also benefit from these treatments. That in a nutshell is what it's all about. And it's already having a major impact. There's a lot more focus on research and development now on pediatric drugs. That combined with an earlier bill that we passed called the Creating Hope Bill, which gave pharmaceutical companies essentially a voucher for expedited review of any drug if they successfully developed a pediatric drug, and it was tradable, by the way, marketable. Those two things have gone a long way to increasing the amount of attention drug companies focus on childhood cancer.
Well, good. Thanks very much, Senator. And it's interesting, you brought up some issues that certainly ring true to our audience. You talked about things like clinical trials, and one of the challenges with pediatric cancers is sample sizes. And can you randomize? What's the follow-up period? Where are the primary and secondary endpoints? So there's a lot of science in there. And that actually does lead me back to Congressman Carter, because one of the emphasized areas there was childhood cancer research and kind of formulating treatments accordingly. So Congressman Carter, I wonder if you'd comment on that. And by the way, in addition to the STAR Act, if you could kind of weave in a bit your role with the Congressional Cancer Survivors Caucus. Is there a direct or indirect tie-in there, Congressman?
Well, there is a direct tie-in, and for a number of reasons, not the least of which is that we are always looking for opportunities to participate legislatively. So when we see legislation that's being introduced, and being on the Energy and Commerce Health Subcommittee, of course, I have access and knowledge of what we're discussing. So that gives me an advantage in that sense. But so anytime we see it, we want to be active in it. And I want to give a shout out to my co-chair of the Cancer Survivor Caucus, Representative Mark DeSagne from California, who he actually is a cancer survivor. I am not a cancer survivor. However, like probably everyone on this call, everyone on this video here, I've had a family member. I've known someone who has suffered from it. So to say that I don't have any experience would I think be erroneous. Of course, being a healthcare provider for so many years, I had a lot of experience dealing with cancer patients and with cancer survivors. And Dr. Goodman, thank you for what you mentioned earlier about the other things that these families deal with, co-payments, all of the thing and access to medications that a lot of community pharmacies don't necessarily carry a lot of meds that these patients are going to need. So helping them to access that medication, helping them to navigate the insurance, making sure that they are getting reimbursement, making sure that they're able to afford it. And if they're not able to afford it, making sure that they have avenues and direction where they can go to get help. All of that's so vitally important. It's all part of it. And certainly, again, with the STAR Act, it was, that was something that Representative DeSagne and we worked on together. And we knew that we, as co-chairs of the Cancer Survivor Caucus, we knew that we needed to be pushing that. And we used our resources to get that through the House. And we were very proud of that.
So Dr. Carter, Congressman Carter, you did finish talking about the Congressional Cancer Survivors Caucus and that connection there?
Yes, I did finish.
Good, very, very good. I wanted to bring back an issue that I think both of you alluded to earlier, and that is working across the aisle in bipartisanship. And I'm just curious, again, starting with you, Congressman Carter, and then back to Senator Van Hollen, is cancer an issue that is readily accessible across the aisle? Is it a bridge issue, or are there still some difficulties in getting business done insofar as cancer patients and constituents? Can you make the bridge, especially in these rather difficult political times? Congressman?
I would answer that with an emphatic yes, we can. I think this exceeds all partisanship. There's no question about it. When we start talking, particularly when you talk about pediatric cancer, I mean, let's face it, it tugs at the heartstrings of all of us. And, again, I draw so much on my professional experience as a pharmacist, because look, I've seen cancer impact every class. I've seen it impact every race. I've seen it impact everyone. Cancer does not discriminate against any, it doesn't matter how much money you have. It doesn't matter what race you are. It doesn't matter, obviously, what age you are. And it's an awful, awful thing, but to be able to help patients, and particularly with what we're trying to do legislatively, it is what we're here for and what we're doing. And I might add, because I'm very proud and to be on the Energy and Commerce Committee. I would submit to you that the Energy and Commerce Committee, and I say this often, and I mean it sincerely, I would submit to you that the Energy and Commerce Committee is the most bipartisan committee in Congress. We work together on that committee. We do. When you think about having, health in that committee as one of our subcommittees, when you think about all the things that we deal with energy and with telecommunications, all of those things they're not partisan issues. I mean, this is not like, some of the other things that we deal with. These are real life issues that, when you start talking about rural broadband, you're not talking about a Democrat or Republican who needs broadband in the rural areas. You're talking about an American who needs broadband in the rural areas. So it does transcend, I think. So I would definitely say we work together on these type of issues.
Good to hear, Congressman. Senator Van Hollen, would you concur and give us a little bit more insight about how you make that happen on a bipartisan basis? Senator?
Yes, I agree with Congressman Carter. This is something that brings people together as Americans, as fellow human beings, trying to make sure that we can work together to develop cures and treatments to various diseases. And that's why you have these bipartisan caucuses in the House and in the Senate. That's why all these bills have been bipartisan. I mentioned when I teamed up early on with Congressman Deborah Price from Ohio, and every piece of legislation that I've worked on in this area has had that bipartisan support. And then with measures like the STAR Act, which are building on some of the earlier legislation, is really important. That was bipartisan as well, and it requires funding, because what the STARS Act calls for is developing better cancer registries for pediatric cancer, really empowering the NCI to go out and gather more data in a more timely manner, providing grants to state cancer registries and pediatric cancer registries. And so on the Appropriations Committee, which actually is a pretty, in the Senate overall is a bipartisan committee as well. Obviously, we have our differences on some issues, but on this issue, there's consensus. And we've been able to fully fund the STARS Act at $30 million a year because what the STARS Act did was create the authorization, sort of the authority for these programs, but obviously without our following up with the money, it's hard to implement them. But so I'm pleased to report that on a bipartisan basis, we've been able to do that. And a bipartisan basis, strong funding for NIH. Roy Blunt is one of the senators overseeing the committee on Appropriations Committee. We are this year, we're finalizing the appropriations, the omnibus for the coming fiscal year, but we are going to see record amounts for NIH, over $40 billion, $43 billion. Obviously, a lot of that goes to the cancer research, and because of the STAR Act, we'll also have some more focus on pediatric cancer.
Great. Sticking with you, Senator, we've got a couple questions coming in on kind of a convergent topic here, and that has to do with disparities. And some of our questioners have noted that the COVID pandemic has only broadened or widened some disparities. And to what extent in the field of cancer care are you thinking about, or have you thought about how to try to close those gaps, disparities in healthcare access, disparities in healthcare outcomes, maybe even more difficulty or challenges in getting to the kind of care to which our keynote referred? Can you address a little bit about that issue about disparities in cancer care and what your outlook might be for that? And then I want to ask the same of the Congressman.
Well, the question's right on target, which is the COVID-19 pandemic has exposed all sorts of deep disparities, inequities in many different systems, but in the area of healthcare, you have, minority communities of color, African Americans, Latinos have been disproportionately impacted, both because, those groups are disproportionately part of our frontline workers who are exposed, but also because of inequities and within our healthcare system and access to affordable care. So we're very focused on, first of all, making sure early on we collected the data so that we could see through the data, as well as through talking to our neighbors and communities, the disparities. But the purpose of collecting the data is to inform policy and now make sure that we get help focused on where it's needed most. So when it comes to distributing a vaccine, frontline workers will be among the prioritized groups. As you know, different states are sorting through those issues. The access to affordable care is obviously a much broader issue. I am a strong supporter of the Affordable Care Act and the expansion of Medicaid under that legislation. I wish all states had taken that expansion. It would open the doors to affordable health care for millions more. I support President-elect Biden's proposal for a public option under the Affordable Care Act. There are many things that we need to do to knock down barriers to affordable care. And I will mention one other thing in this area of developing treatments to drugs, which is just as kids have been underrepresented in a lot of clinical trials. So, for example, for cancer drugs, it's also a fact that minorities have been underrepresented in a lot of clinical trials and for different. So I have legislation introduced to address that issue, because we need to make sure we involve a greater numbers of minority individuals as part of these trials.
Thanks, Senator. You know, it's interesting. Very glad you mentioned data and registries. Again, a lot of our listeners really are evidence-based people. We do research and we apply policy that way. You've talked about registries, clinical trials, and other data sources important. Your state, as well as Congressman Carter's state, you're both characterized indeed by very broad disparities in healthcare and by having some of the premier healthcare institutions right in your state, Johns Hopkins University being in yours, of course, Senator. And I know that Congressman Carter, in your state, there are several important institutions. Having been a former Georgia resident, I was familiar with Grady Memorial Hospital in Fulton County, which provided essential services to many people subject to tremendous disparities. So thank you, very much, Senator Van Hollen. Over to you, Congressman Carter. Can you reflect a bit on this issue of disparities, whether in oncology or beyond?
Well, certainly, I think that the disparities have been challenging. There's no question about that. And they have been heightened and highlighted, if you will, and become more evident throughout this process. That's one of the reasons, and you know, I want to thank the Senate for helping as well. But when we passed the CARES Act, a lot of that funding went to our FQHCs. A lot of the funding went to our community health centers, and that's where it needed to go. And we recognize that, and I think we addressed that issue. You know, it's been a particular problem, I think, during this pandemic, and it's certainly something we have to look at, certainly something we have to continue to address. My hope is that we're going to get another package done. I'm not at the pay grade, if you will, to where I'm in the negotiations. So I don't know if we're talking about more money for the FQHCs or for the community health centers, whatever, but I certainly think that is needed. There's no question about that. That's been very important. But if I could just add one thing to this, is that because unfortunately, I've had some personal experience with this just recently, is the impact that it's had on family members and caregivers as well. You know, my dad's in the hospital right now, and you know, we can only have one visitor at a time. And at this particular rehab hospital he's in, you have to designate who that visitor is going to be, and it can only be that one person the whole stay in the hospital. Otherwise, you know, you're at the window talking through a cell phone. And, you know, it's one thing to have constituents tell you about that and try to articulate that and make you understand. It's another thing when you experience it, like my family has just here recently.
Yeah, well, I'm sorry to hear about your family member, but I've got to say that, again, a community pharmacist knows as well as anyone what it takes to deal on a day-to-day basis with people in the community, the patient, the family members, and the broader community support. So I think it's obviously you're well positioned to make those considerations. Speaking of considerations with regard to the people you see often and from whom you hear, Congressman Carter, I want to ask you, and then following that up with Senator Van Hollen, about the survivors and the family members as advocates. And do you have any advice or insights about an efficient and appropriate way to approach you as a lawmaker on cancer care issues? What can you say about that, please?
There's no question about it. The grassroots effort is essential, and it has got to be part of anything that we do. You know, emails are great, letters are fine, but that hands-on grassroots experience. You know, we're in the district a lot. We have been, you know, of course, the pandemic has put forth more barriers and more challenges while we're in the district. But, you know, inviting your senator, your congressman to see your family member. It's one thing to get an email and to hear about it. It's another thing to see, this is my daughter, this is my son. She is a cancer survivor. He is a cancer survivor. You know, explain what you've gone through. That's impactful and that's strong. And I just can't say enough about the grassroots effort. That's one thing. We haven't had a pharmacist in Congress for many, many years. And I've kind of had to jumpstart, if you will, our profession into, guys, y'all need to be involved. And that grassroots effort is so vitally important.
So you're really focused then on the personal stories and interaction that way to kind of make an impression. That's very helpful to know, because we often don't know kind of how to pitch our story for policy change. Thank you. Senator Van Hollen, from your standpoint as well, what have you found to be the most effective ways of informing and perhaps even sort of influencing the way you craft legislation?
Well, as I mentioned when you asked me, how did I first get really involved with childhood cancer, it was from, stories from moms and dads who either lost their kids or were able to bring their kids with them because they were in the process of, fighting cancer and in many great cases surviving cancer. And I think that those personal stories about how our past efforts have been helpful, but how we need to continue to focus on our cancer fighting efforts make such a difference in people's lives. I will say, in many cases as well, and this is always helpful to have, the nurses and the doctors and the medical teams that work on these issues every day, treating patients with cancer or treating whether it's adult cancer or pediatric cancer. Those are also essential in terms of, I think, painting a picture of what is required. And then it does help to have, folks from NIH and state and local governments who are very involved on the front lines as a matter of, public health agencies. So I think, from public health, representatives to the practitioners themselves, the doctors, the nurses, to the patients and the parents, and I think really all of that has been successful. I mean, every one of these efforts that I'm talking about, from the original, Carolyn Price conquering childhood cancer legislation, to the Creating Hope legislation, to the STARS Act, to the Race for Children Act, all of these have involved a coalition of people coming together at the grassroots level.
Thank you very much. And once again, you've got a lot of grassroots with which to deal, Senator. You've got all kinds of communities across the state: Western Maryland, Baltimore, the Eastern Shore, and the shore areas. And then you've got these wonderful institutions, Hopkins, Maryland, and others. And then NIH is kind of right up the road from you too. So I would imagine you've got a lot of folks that want to talk to you and vice versa.
Well, that's exactly right. We have a great ecosystem in Maryland, very diverse state, geographically and demographically. And as you say, some great institutions, and the home of NIH and the FDA.
Yeah.
So a lot of folks from all those communities that I just mentioned coming together to fight disease and fight cancer.
Thank you, sir. And Congressman Carter, similarly, in your highly diverse state that has that full range of socioeconomic diversity, you also have, as we said, Grady Memorial, Emory University, some outstanding educational institutions, and by the way, the Centers for Disease Control and Prevention. So there are all these resources there that I'm sure are kind of grabbing for your attention as well. As a closing comment, starting with Congressman Carter, sir, again, these are very difficult times. Is there any single policy change or impact or alteration from a legislative or other policy standpoint that could benefit cancer care and or the broader healthcare ecosystem? If there's one kind of lever you could pull, Congressman, what might that be in the next 2 to 4 years?
Well, certainly, my main focus since I've been a member of Congress has been prescription drug prices. And that's something that, I've been laser focused on, and I continue to be focused on, and I'll continue to work on. That's extremely important. Surprise billing is something, as a pharmacist, I'm a member of the Doctors Caucus here in Congress, and we were working on surprise billing, and hopefully we can get it in some of the legislation before the end of this session. But if we don't, that's still going to be a big part of our agenda for the next couple of years. And certainly that's important to these families. I suspect that many of these families have experienced that surprise billing before, and they don't know how to navigate that. That's extremely important. So all of those things will continue to be our focus. But one thing in particular, particularly during this pandemic and particularly in the immediate future, you mentioned, and in Georgia, we do have such great healthcare and so many great facilities, including Children's Healthcare of Atlanta, CHOA.
Oh,
And they've been suffering too financially. I mean, we and the senator and I and members of Congress need to make sure that these healthcare centers remain financially viable as well.
okay. Well, you brought up a couple of really key issues there. And so back over to Senator Van Hollen. Senator Van Hollen, what's that one lever button you'd like to push from a policy standpoint to strengthen cancer care and or the broader healthcare ecosystem?
Well, let me do the 2 weeks and then the 2 years, right?
Okay.
There are two measures before Congress right now, which would be essential on these issues. Number one is to pass the omnibus legislation to keep the federal government up and running. That contains things like the funding I mentioned for the NIH. It includes essential funding for we'll also do the healthcare piece, which includes the community health centers, which Congressman Carter referred to, and it includes funds for hospital systems and healthcare systems around the country on an annual basis. So we got to get that done. The other is the emergency coronavirus relief effort. And again, the House has passed legislation 2 times, sort of very comprehensive proposals to deal with this as follow-ons to the CARES Act, which was a great bipartisan success story earlier in the summer. In the Senate right now, we are working very hard to try to to develop a bipartisan proposal. It's a $908 billion proposal to take us through these very difficult winter months, 4-month period. It would provide additional funding for personal protective equipment, for community health centers and for hospitals. Also includes funds, about $16 billion for the rapid vaccine deployment to the states for administration of the vaccine. And then funds to deal with the economic impact, folks who have lost their jobs because of the pandemic, small businesses, state and local governments on the front line. So we're pushing hard. This would be very important to fighting the virus and to keeping our economy afloat to get this done. In the longer term, I would agree with the Congressman Carter about prescription drugs. I really think that this is something where we can lower the cost. I've got a number of proposals. There are a number of bipartisan proposals that we can deal with. And then expanding access to affordable health care. I mentioned the President-elect's proposal to expand access and build on the Affordable Care Act going forward. So I think we've got a lot on our plate, and hopefully we can get it done both in the next 2 weeks and over the coming years.
Well, thank you, Senator.
Everybody on this call, because you are the folks that we turn to for ideas as well on the policy side, and you're on the front lines on so many of these issues.
Well, thank you, Senator. I must comment for both of you that we've had some additional chat action and questions, some of which have reacted favorably to both of your comments on closing disparities and gaps in access. And I think that really rang true to a lot of our folks. Some other comments came in insofar as how you both seem to have kind of a community touch and good relationships with the grassroots throughout your community. So those issues, I just want to let you know, have resonated with your listeners. And with that, we just really want to thank Congressman Buddy Carter from Georgia and Senator Chris Van Hollen of Maryland for your leadership in this field, particularly in oncology, as well as caring for kids with cancer. That's not only leadership that you've made to date, but it sounds like you know how to carry it forward. We appreciate your generosity and your commitment, and we hope that you'll retain very close ties with NCCN and our broader community. Thank you, gentlemen, both. Much appreciated, sirs.
Thank you.
Thank you.
Be with you. Thanks.
Thank you both.